right way, we can really impact change for the population. And that's really what we saw in Manhattan. I also worked at KCMO Public Health, and now I study all of these cool things with my colleagues here at at UMKC as well as over at KU Med. And so happy to be here and really interested to see everybody. I want to pass it over to Vicki, who is 110% awesome, and for her to introduce herself.
Hi, good afternoon, everyone. I'm Vicki Kelly-Akers. I'm an associate professor at KU Med Center. I'm also a shared staff person with Lawrence Douglas County Public Health. Around physical activity, I think my work is focused in two areas. One is conducting research and evaluation on initiatives, community-led initiatives around childhood obesity prevention, as well as health equity initiatives for Latinos in Kansas City, Kansas. And I will pass it to Stevie.
Hi guys, I'm Stevie Watley Hopkins. I work at the Wyandotte County K-State Research and Extension Office. And so I have a master's in public health. My title here is FNEP agent, it's a federal program that we do through K-State and other colleges that are land-grant universities around the United States. It's the expanded food and nutrition education program. So I work a lot with families who are living in poverty, who just need some help learning how to stretch their dollars a little bit further and eat more healthy and hopefully get some more physical activity in the process. And Chelsea, I'm gonna send it over to you.
Yeah, so I am Chelsea Reinberg, and I am with K-State Research and Extension in Johnson County. My role specifically is the Nutrition, Food Safety, and Health Agent. And I'm a registered dietitian, and I did my one of my dietetic internships for my community health with Robin and Shelley. And so very familiar with the KC Physical Activity Plan and help them with some of the activities around it while I was there, and have sat in and know several of the other work groups as well, and knew this one was kind of on the horizon. So happy to kind of be in the start of this one and to get re-engaged as a partner this time and not working with Children's Mercy. So nice to see you again, Robin, and everyone. And I will pass it to Simone.
Hi, everyone. I'm Simone Taylor. I am the Regional Women's Health Analyst in the Office of the Assistant Secretary for Health, so I'm under HHS. I'm a nurse by profession. I have been one for, 15 years now. I work on all kind of issues, just women's health. And so we cover the region, which is Missouri, Kansas, Iowa, and Nebraska. And so I try to work with partners like, you all to work on issues to support and improve health outcomes for women and girls. And so we have other folks in our office who have been a part of this work group as well, and we're trying to re-engage. And so I was happy to see the invite. So it's nice to be here. Oh, Dahlia, I'll pass it to you.
Hello everybody. So I'm Dalia Youssef. I am originally a clinical pharmacist, oncology clinical pharmacist. I'm registered now for my degree of Doctor of Public Health. I have over 14 years of experience in programs for cancer prevention. Also to improving the healthcare quality of service for minorities. Currently, I'm based in Germany. And I'm working as a medical affairs manager in a pharmaceutical company interested in nutrition services. So also I'm focusing on the malnutrition cause and how to improve the nutritional services in Germany. Thanks a lot.
Robin, you want to go next?
Yeah, happy to. Hi, everybody. My name is Robin Shook. I'm an associate professor at Children's Mercy, and I'm the director of what is still weighing in. We're going through a name change soon, so soon it'll be something different. But you'll hear more about what I do when I give my little spiel on the Kansas City Physical Activity Plan overview. But great to see everybody. Great to see such a good group of public health practitioners in this very first meeting. So let's see, I'll hot potato it to Donald.
Hey everyone, I was wondering when it would get to me. Sorry, I was eating. My name is Donald Okanta. I work at Johnson County Health Department. I'm a disease investigator for the Division of Epidemiology. I'm actually kind of new to public health. I've been working for about 2 years. Most of that time has been COVID, so now we're switching over to normal stuff. So being part of this group is very exciting for me. Right now I'm working on disproportionate minority contact with the justice system work, and trying to expand out to other things. I know I'm from Kansas City. Physical activity has been very important to me in terms of my growth, how to have an outlet with different things. So being part of this group and making physical activity more accessible to more people around the city, around the region, is a very important thing for me to do, to be a part of. And who is left?
I think just me.
Shelly? Okay, Shelly, I'll throw it to you.
Great. Hi, I'm Shelly Summer. I manage the weighing in program at Children's Mercy, which is soon going to be called the Kansas City Healthy Lifestyles Collaborative, as you just heard. We're excited about that shift. I've been at the hospital for a really long time. In fact, maybe longer than some of you have been alive. I am a registered dietitian by training, and I have a master's in exercise physiology, and I'm thrilled to be part of the physical activity plan. I also support the healthcare sector, the faith-based settings sector, and then a couple of others. So happy to be here. And we were thrilled to have Chelsea as a dietetic intern with us as well. Glad to see her back in a real position.
We actually do have one more introduction. This is Natalie. I'll let her introduce herself.
Yeah. Hi, everyone. I recently joined the weighing in team, soon to be Healthy Lifestyles Collaborative. I'm on my 3rd week going into it. So I am attending all the sector meetings and getting to know all you guys. I'm looking forward to working with you.
Okay. Well, it's great to meet everyone. We're gonna just jump in here. So Robin had mentioned he's gonna talk about the Kansas City Physical Activity Plan. Do you mind going ahead and discussing it a little more, Robin?
Yeah, I'm happy to. I'm just going to try to take like 5 to 10 minutes to give you a broad overview of the Kansas City Physical Activity Plan, so you have a context about what is happening outside of the public health sector. And we think this is really important because one of the unique aspects of the Kansas City Physical Activity Plan is that it is multi-sectoral, meaning that you guys are going to do great things within the public health sector, but there are also 9 other sectors that are also doing really great things, and they're connected all to each other through this broad umbrella of the Kansas City Physical Activity Plan. And so let me just share my screen real quick here. All right, are you guys seeing the appropriate slide? Okay, all right, sounds good. All right, so first of all, I'll give you a brief overview of weighing in. So, and I'll throw that up there. Weighing In has been a program at Children's Mercy for over 10 years. We think it's closer to about 15 years now. And it is a program at Children's Mercy that seeks to align community organizations and community programs around that are focused on healthy lifestyles and childhood obesity. You can see our mission and our vision right up there. But really the most important takeaway from what we do that I want you guys to understand is that we try to connect lots of diverse organizations and partners, meaning we think we are one of only a few organizations and programs in Kansas City that connect school PE teachers to pediatricians and sports medicines and public health and let's see, what's another one? And faith-based settings. We can connect all of those people within our umbrella because we've got about 900 partners within Weighing In. And they're across all of those different sectors. Because we like to connect people and get people working together, we host a lot of meetings. We've held, this number is outdated. It says 120 meetings since 2022. Actually, the most recent number is closer to 200 meetings in the past 2 years. So we have lots of meetings, we host lots of meetings, we send out lots of newsletters, and that's a big way of how we try to connect people. And this is, as you can see, this is a slightly outdated slide because we don't even have Natalie listed as our staff members, but our Weighing In team is Shelly, the program manager, Katie, who you've met already. We've just filled Natalie and hired Natalie, so we're excited to have Natalie. We have Veronica, she's a Vista, she's wasn't able to attend this meeting, and then myself, I'm the director. And we are rebranding in 2023 to the Kansas City Healthy Lifestyles Collaborative. It's kind of a mouthful, so we're working on a shorter acronym for that right now, but this reflects our shift away from just focusing on childhood obesity to healthy lifestyles. Okay, so Kansas City Physical Activity Plan. We started this in 2020, just before the pandemic hit. It's based on the National Physical Activity Plan. If you're not aware of the national plan, maybe Katie, you can throw that link in the chat as well. The National Physical Activity Plan has been around for about 10 years, and we basically model ourselves exactly on the national plan. The Kansas City Physical Activity Plan is a comprehensive multi-sector collaboration working to foster a culture of active living in Kansas City with the goal of creating safe and equitable opportunities to live an active lifestyle in our region. It can get kind of confusing because we throw out lots of different terms when we're talking about the Kansas City Physical Activity Plan, but basically at the highest level, we have the plan itself, the plan itself. And then that plan is organized by 10 societal sectors. Each one of those sectors has developed strategies, which are kind of broad, general goals for a sector. And then within each strategy, there are anywhere between 2 and 5 tactics. And tactics are more specific, objective things that can be done to achieve the strategy. And then ultimately, we don't want this plan to be something that sits on a shelf. So implementation of those strategies and tactics is a big part of what we're doing. And I'll talk a little bit more about that in a second. I already talked about the goal, so I'll skip over that. But I do want to talk about the overarching priorities. So in addition to the sector-specific things, we have 3 overarching priorities. The first one is to advocate for local funding for physical activity initiatives in our region. As we know, ultimately, we have to have money to do these things. And anyone who works in the space knows that there is a relatively small pool of funding for physical activity initiatives within our region. And it seems to be shrinking, actually, rather than getting bigger. So we collectively want to advocate for increased funding. The second overarching priority is regular comprehensive surveillance of relevant physical activity metrics. And the third is related to that, that is the reporting of those metrics on a regular basis. And we choose to do that through a regional physical activity report card. And I'll talk a little bit about those things in just a slide or two. So here are the Kansas City Physical Activity Plan sectors. Additionally, I have listed who is the lead for each of those sectors and what their current implementation groups are focused on. So I won't talk about all the leads and all their implementation groups. I'll just talk about the sectors here for time purposes. But we have schools, sport, faith-based, early childhood, healthcare, mass media, business, public health, parks and recreation, and infrastructure. So essentially what we want you, these are organized by how people spend their lives and how they live their lives. So hopefully, as you look at this list, you can say that on any given day, I touch probably 2 of these sectors. And over the course of a week, you probably touch, I don't know, 7 or 8 of those sectors. So you can start to see where if each of these sectors starts doing even just a couple implementation projects related to strategies within each of those sectors, you can see how all of a sudden we're building up a collective pool of activities that we think will have measurable impacts on physical activity in the region. We have kind of 3 publications that are available on our website right now. I'll talk about 2 of them just real quick. The first one is the one on the left-hand side of the screen. That's the regional report card on physical activity for children and youth. I'll go into detail on that in the next slide. And then the other one I'll talk about in a couple slides is the actual physical activity plan. The one that's in the middle is what we call our playbook. The actual physical activity plan, which is right here, is about, I think it's like 50 pages long. Actually, no, excuse me, I was quite short. It's 75 pages long. So there's a lot of information in here. We realize most people don't want to read all that. So we created the playbook version, which is a much shorter, abridged version of the plan itself. So if you just want a high level overview, you can look at the playbook. So that's all I'll say on the playbook for right now. All 3 of these are available on our website. So the report card is a big part of what we do because, as all of us in public health know, you can't identify where areas of need are or track your progress in those areas if you're not doing good surveillance of those metrics. So we created this report card in 2020. We are scheduled to do an update of this report card every 5 years. So our next one will be in 2025. And we created grades for, I think there's 9 metrics here: overall physical activity, sedentary behavior, active transportation, so on and so forth. This is all using local data. And I'll talk a little bit about those data sources in a second. And we assigned a grade based on predetermined criteria. And as you can see, our grade, The best grade that we have is a B-, and that's for organized sports participation. The lowest is active transportation, which is an F. We also have several incompletes, and that's for because we don't have local data on those indicators. Speaking of data, we also know that on the local level, it is hard to get good data. So for each of those indicators, we also created a data quality grade. And those grade criteria were determined ahead of time. And as you can see, we have some indicators with actually pretty good local data. There's a lot with incomplete data or poor data. And I won't really talk too much more about that here, but if you have questions, you can look at the report, or you can grab one of us, send us an email, and we can talk a little bit more about those criteria. So I just wanted to, I'll just quickly show you what these look like. For overall physical activity as an example, we have our grade, which was a C-, the data quality grade. Then we talk about we list the criteria that we evaluated the indicator on, the key findings, considerations and other data, and then discussions on the data quality, and wrapped it up with some recommendations. So it's a really good and I think thorough snapshot of what physical activity looks like across multiple indicators in our region. So I'll move on and wrap up with the physical activity plan itself. So that's the document that's on the right-hand side of your screen. The first version we released was in 2021. We're about ready to release a second edition that'll come out in the next couple months of 2023, we think. And it includes information on all of the strategies and tactics for the Kansas City Physical Activity Plan. And here are all of the strategies that we have identified as of right now for the plan. And so we're up to 34 different strategies. I calculated tactics once. I don't know if I listed on the slide. I think we've got something like 80 different total tactics that support these strategies. So there's a lot of information that is in the plan and then within each sector that really kind of guide us how we can create opportunities to be physically active. So if you look at the report, each sector has its own section. Here, example for healthy schools. It's got an overview of the sector, the strategies, how the strategies were developed. And as you can see here, we got lots of different feedback and youth voices and surveys. And then it goes into more detail on the strategies and priorities. So for strategy 1, for healthy schools, there were 3 priorities. That we have a page essentially for each of the strategies. And then at the very end, we have what we need to do moving forward. So how to deal with local leaders, how to do community involvement. So I mention this as an example because at the end of the process that you're beginning right now, the public health sector will have a very similar set of information. Strategy, tactics, development techniques, how you engage with partners, and ultimately what to do next. Yeah, so as I mentioned, the strategies are more broad, evidence-informed approaches to promote physical activity. Tactics are more specific items that support each strategy and current things that people can do and highlights of things that people are doing already. And then this is the last slide I'm going to show you. I wanted to show this one because each sector is a little bit different. So for the healthcare sector, if you would look through this, it would say the healthcare sector met X number of times. We used a whiteboard tool. We also got youth feedback, and we did a survey. That's how the healthcare sector did, or the school sector did their strategy development. Here is the most recent sector that came online, and that was the mass media sector. They did all of their strategy prioritization in a virtual whiteboard. And as you can see, they started out by ranking some strategies. They did some other prioritization based on impact and ease of implementation. And then they did some more specific thinking through barriers, implementation, other things to consider. And so that's how mass media did it. And you guys will decide what the best format is for this sector. And ultimately you'll arrive at something that looks like this, which is four strategies. That's what healthcare decided on. They have looks like anywhere between 3 and 4 tactics for each of those different strategies. And I'll just go quickly through them so you get an idea of the scope of them. Again, this is for the healthcare sector. Strategy 19 is to promote evidence-based physical activity services to reduce health disparities. Strategy 20 is to increase physical activity assessment within the healthcare setting. 21 is recognize that physical activity and inactivity is a treatable condition. And 22 is that healthcare professionals should receive basic physical activity education as part of their medical school or nursing school curriculums. And they have tactics that support all of those things. And just for example, the healthcare sector right now, we're having meetings right now to get physical activity curriculum in the UMKC School of Medicine residency program. So that's a great way that they're trying to move forward with strategy number 22. Okay, so that's a real quick overview. I probably talked a little too long there. I'm happy to ask any or answer any questions if you have any. Otherwise, I'll turn it back over to Joey and Katie.
So Robin, real quick, I just want to reemphasize kind of the goal of this sector is to figure out how to use governmental public health to improve physical activity for the metro, right? Yeah, and then the way we're going to do that, guys, is we'll look first at the National Physical Activity Plan that has a public health sector. And Katie, I don't know if you want to throw the link to the public health sector in the chat, but we can look at the strategies and tactics that the National Physical Activity Plan already has and kind of pick which ones seem appropriate for Kansas City, and then really follow up on, what do we do next? Do we need to do figure out, what exactly is going on in governmental public health in KC? Where's the funding streams? How does local public health, how do local public health impact physical activity rates? Is that through like CHIPS? So making sure to get physical activity in all of our community health improvement plans? Is it making sure just to like assess, right, through community health assessments? There's a whole bunch of things that could be done. And that's why I think this is really, really powerful, because we all, in our individual positions can really push physical activity forward. And like, we know that physical activity is one of those linchpin behaviors for a population that if we could increase physical activity, a whole bunch of other things downstream are impacted. So I think this is really impactful work for the future. But Katie, I'm sorry.
Well, and the only thing I was going to just add to that, Joey, I mean, that's well said. One thing that we've really tried to do with all the other sectors is everyone in this Zoom meeting is incredibly busy. And we don't want to create really new work. Most of you are already doing this work. It's just a matter of aligning the efforts between organizations or institutions. And so that's what a lot of this is. I mean, maybe in 5 years or something, everyone might come together and say, hey, let's write a grant together to fund this new project. But in the short term, it's mostly just like oh, we're doing this at Johnson County. Oh, well, we're doing this at Jackson County. How can we maybe align our efforts so we're all doing similar type things and measuring things the same way? And we found that the most successful sectors within the plan are the ones that really leverage that, those existing things.
Katie, what are the next steps?
No,
Can I just ask, so I'm assuming this isn't everybody, I guess how many people, I can't remember how many people are kind of on the other sector work groups, and how many do you anticipate being in this initial planning stage versus like later stages?
If you want me, I'll just offer up what, again, other sectors have done. So there's a lot of diversity between the sectors. But I would say in general, the sectors take all comers, as many people as they can get to come to these meetings for this strategy development, they'll take. It's been anywhere from 5 people in some sectors. It's been up to 20 people in other sectors. And that's okay. It doesn't really matter as long as people are contributing. I don't know about you guys. I don't really like attending meetings where all we do is talk about priorities and things and not do any action. So we found that the hardest part of this whole process is what you're starting right now, is strategy prioritization. Once that done and is completed and you start moving into implementation and you're talking about, like the healthcare sector is a great example. They're talking about adding in curriculum. So they get like 25 to 30 people attending a meeting because lots of people are interested in that. So these groups tend to grow as you start to actually do things. But I wouldn't get too focused on the numbers as long as you're getting good feedback and good participation. That's really what, from our perspective, we look for.
And Chelsea, the only thing I'll add to that question is, we know that when we set a meeting, that the only people who can attend are those that have that time free. And there are others who might be interested in sharing their perspectives related to the project. So we encourage you all who are attending to reach out to others who might be interested in informing the efforts to get their feedback and bring it back to whether it's the meeting or other work groups have used different strategies to get feedback. So it might be a survey that's sent out. So we encourage you to send it out to others that whose input would be really valuable to the work being done. So we don't want the meeting time to limit the ability to get broad feedback from those who really are experts.
I'll just add that like public health has been through the ringer the last few years, right? And like my friends at Wyandotte and KCMO, they're just like too busy, right? They can't devote one more energy to something new. And that's why I think a survey or something, would be more appropriate. And we can talk about that at our next meeting of like how we want to get that information and what we really want to look at.
One thing I guess I should add that I didn't add to my slides, or I glossed over it, is we have received funding from a philanthropic donor to support implementation projects. And so we have a minimum of $10,000 for each sector to use as seed money for implementation projects, with the idea is that this small amount of money will help kickstart some things that will turn into bigger things later on. And so as you guys get done with strategy development and tactic development, and you start thinking about implementation projects, though there's a minimum of $10,000 available to get that work started. And the sectors, just because of weighing in's capacity, we kind of started them in waves. So public health is like the third and final wave. So other groups are doing implementation projects right now. But you guys will be doing them, you know, in like 6 months or whenever it is. So you're at slightly different points along the journey, but we do have those funds that we're going to hold for this sector no matter what.
And Robin, I think that's really important because one of the national physical activity plan strategies in public health is to, you know, maintain the workforce, right? And increase physical activity among the public health workforce. And so that could be a like first easy step in, you know, promoting physical activity in public health is getting public health folks active, which we know are a little less active than the general population. So those are the kind of things we can do, Chelsea, and like, yeah, move all that stuff forward. Good questions.
Well, I feel like Robin and Joey covered a lot of what I was going to discuss, which was kind of just like how the next couple meetings are going to look like, kind of like your commitment to this group moving forward, and what the next couple, I already said that next couple meetings will look like. But typically with our other sector groups, we meet once a month for usually about an hour. Some groups might meet for an hour and a half. Some might take it upon themselves to meet twice a month. Robin, as Robin pointed out, everyone's really busy, so we understand, like, and then moving forward though, we do want to get our strategies and tactics prioritized. If this group decides to kind of develop those in a similar format as mass media, I have already created a Mentimeter survey, which is what mass media had used originally to rank each strategy. So that is an option, but we will be proceeding at our next meeting with ranking those. And then our third meeting, we'll go ahead and kind of like determine what is higher hanging fruit and what is lower hanging, what can we achieve and what can we not achieve. But on that note, our next meeting is actually already scheduled. It won't be for January. We know everybody is coming back from the holidays. January is kind of a busy time. It's the beginning of the new year. So the next meeting is actually for Thursday, February 16th. It's at noon again. And something to think about as well is that if this time doesn't work for the majority of the group, we can always switch the time and date. This was just something we determined ahead of time that worked for some of our schedules. But if you'd like to register for the next meeting, the link is in the chat. But that's all I have. Does anybody have any questions? Oh, I lied. One more thing. So Chelsea, you pointed out like how many people does it take to start, and Robin had mentioned it doesn't matter the number, but that is something to think about. Look at who is here and who is missing and invite them to the next meeting, because that's what we're working on. That's why we wanted to have this initial meet and greet meeting, just to kind of see who's here now and who do we need. So yeah, but does anybody have any questions?
I was just going to, can you talk just Katie real quick about what happens after the meeting? If I know you do a great job of taking notes and things.
Yes, so after every meeting, I will send a newsletter that kind of provides resources for what the group had mentioned during the meeting, or once we get our strategies and priorities kind of going, it'll align with those. But I also send a recording link of the meeting. So we have a YouTube channel, so you can find all past recordings for other sector groups, as well as this one on our YouTube channel. And I will try and find that link right now. If you're interested.
I can find it, Katie.
Thank you.
And
I also include a copy of the notes. So I believe I take good notes, and that'll be included in the newsletters. So that anybody who does miss a meeting can at least have an overview of what happened, so they don't, feel behind. Thanks, Robin, for dropping that.
Yeah,
Yes.
go ahead. Sorry, Robin.
Well, no, I was just going to say that link has all the newsletters for all the different sectors. So You can just click on the icon for whatever sector you're looking for, and it has all those things that Katie was just mentioning. It comes from, we use MailChimp to send it. So it'll probably read like from Children's Mercy. Is that right, Katie? I think the sender is Children's Mercy.
It's actually the way I get email.
The weighing in. Okay. Yeah. Gotcha.
And I was just going to add, guys, that this is just a first step, right? So today was like a meet and greet to say hi and kind of get like the ball rolling. You know, in February, we'll start looking at strategies and how to identify, you know, which ones we would like to tackle. And I think this is really where our talents come in, right? So we all have strengths. We all bring like specific lenses to the table. And, you know, how can we use the things that are happening in Kansas City? How can we move them forward? How can we move public health forward in physical activity, and ultimately, you know, get more folks around the metro active? So that's the long-term goal, and I think that we can really do some good work here. So I'm happy to be a part of this group and move it forward. Robin, Katie, anything else for today?
No, but I want to say that I'm really excited to see Vicky. Hi, Dr. Holly Akers. She was a professor of mine, so.
It's good to see you too.
I will. Can I just note real quick? Vicky and I have a paper coming out in March in the Journal of Public Health Practice and Management and Practice. I always get it flipped for some reason. That really, we looked at local public health departments around the country and how they're implementing physical activity objectives from their CHIP. And what we really see is that you know, they're not focusing on policy. They're not focusing on environmental change. They're really focusing on things that have a really less evidence base to support changes in public health. And so I think what we do in Kansas City, if we can figure out how to change that, can be replicated around the country, and then we could really, you know, make some big progress in the US. And so I think that's my, you know, ultimate goal, is to really figure out how to make this happen and how to move public health forward. And I'm happy to do it with you guys.
I mean, like that's the key, right? I mean, what you just said, Joey. I mean, how to do things that really have the biggest evidence base behind them. And like, as I think about across the country and people I know across the country, I find it hard to believe that there's a better group of people than who we have in Kansas City to do this work. I mean, it's just like an opportunity that is just endless possibilities, and I cannot wait for this group to get started. This was actually going to be the first group that we started, and then COVID happened, so we had to delay it. And so, like, this is like, you guys are like the dream team. I'm just so excited.
I think that is all we have for today. Thank you so much for joining us. And if you haven't already, here's the link again to the next meeting. But I'm going to go ahead and stop the recording.